Assalamualaikum, Bismillahirrahmanirrahim. Today we will discuss the most common long cases that there is a huge chance that come in the exam. Note that in the exam any long case can come. The examiners most of the time does not have any long case, so they can put any long case. This should be clear cut, and the examiners will put those long case where there is a huge chance of discussion. For example, the long case will have also HCV positive, and the patient may have diabetes mellitus, or he has taken any tuberculosis in the past, so that there is a prolonged discussion that is possible. So we will start having the list of these long cases. First of all, the central nervous system. Here we can see that the stroke and dural sinus thrombosis that the stroke came to me, and dural sinus thrombosis came to one of my colleagues. Multiple sclerosis, spastic paraparesis, and the Guillain-Barré syndrome, myasthenia gravis, and Friedreich ataxia came to one of our colleagues. And GIT, chronic liver disease, most common. Hepatoma came to one of our colleague. Chronic diarrhea, that was one of my long case that has multiple lymph nodes and generalized lymphadenopathy as well. Celiac disease is another long case. Ulcerative colitis, Crohn disease. So in the and CA colon rare. In the respiratory system, the COPD, the most common long case. Asthma, bronchiectasis came to one of our colleague. Pulmonary fibrosis, consolidation came to one of our colleagues, and pleural effusion. And the lung CA lung carcinoma of the lung came to one of our colleagues. Churg-Strauss syndrome and Wegener's granulomatosis came to one of our colleagues. In the CVS, the cardiovascular system, MS, MR, and aortic regurgitation, aortic stenosis came to one of our colleagues. Congestive cardiac failure, infective endocarditis came to one of our colleagues, and rheumatic fever. In the rheumatology, please note that rheumatoid arthritis, ankylosing spondylitis, juvenile arthritis, and psoriatic arthritis. Systemic lupus erythematosus came to me in one of the lung case, and polymyositis, dermatomyositis came to one of our colleagues. Muscular dystrophy and systemic sclerosis, mixed connective tissue diseases that came to me as one of the lung case. And psoriatic arthritis is also possible. In the hematology, there is a myeloproliferative disorders that can come, and the lymphoproliferative disorders. Mostly they will have the patients will have massa splenomegaly. So you can say that it is myeloproliferative disorder. Give two differentials. For example, you can say that chronic myeloid leukemia or myelofibrosis. Or in the lymphoproliferative disorders, you can say the chronic lymphocytic leukemia or lymphoma, depending upon the age and patient scenario. ITP came into one of our mock exam, and aplastic anemia, DVT, deep venous thrombosis, hemophilia, and iron deficiency anemia came to one of our colleagues, and the other is the HSP, Henoch-Schönlein line purpura. And the in the nephrology, nephrotic syndrome came to one of our colleagues, and CKD can come, and renal mass came to one of our colleagues. That was CA renal carcinoma. And the endocrinology, please note that in the endocrinology, hypothyroidism came to me as one of the long case. Hyperthyroidism can occur, Addison disease can occur, and diabetes mellitus, which include the diabetic foot. And acromegaly is the most favorite one. It comes most on and off in the exam. And in the miscellaneous, HIV came to me as one of the long case. Thank you.